I have a question ask you, if the axillary nerve injury, what muscle going to paralyze? Deltoid muscle. Okay? And what is the symptoms and the sign? And you cannot raise your arm, so you cannot do the abduction of the arm. Abduction of the arm is carried out by supraspinatus, only 15 degree. Beyond 15 degree, deltoid muscle. I'm having problem with those muscles. Anyway, I have a problem with my two shoulders. So deltoid muscle. And this one side is okay. This side is only to here. I hope at the end of semester I can show you I can reach here. And I'm seeing the physical therapy tomorrow. And so hopefully. But it's also up to me. You just have to be very tolerant to the pain. I doubt I'm going to do that much exercise. It's painful. Anyway, so here, deltoid muscle. And this question has been asked you, skeletal muscular system, if you have anything related to the skeletal muscular system, or your board exam, entrance exam, and the future exam, this question always be there. Always be there. Axillary muscle and injure your deltoid muscle, patient cannot raise arm. And also if long-term injury, the patient walks to the doctor's hospital, hold the shoulder, no more round shoulder, called a flattened shoulder, because the muscle atrophy. So totally flat. You're supposed to have a round shoulder, no? So it's a flat shoulder. Okay. So that's the first one. Second one is the muscular cutaneous nerve. The muscular cutaneous nerve, I said, supplies anterior arm muscles. So this is the muscle here. What is this muscle? Biceps brachii. Under this biceps brachii, big flat muscle, brachialis. Brachialis. And what is this muscle? Coracobrachialis is your armpit muscle, coraco. Anterior arm, you also have this brachioradialis here, but it's not by this nerve. It's by radial nerve. So we'll talk about it later. So there are three muscles here by muscular cutaneous nerve. The injury, you cannot flex your arm, but I'm not asking you. Okay? This nerve is not as commonly injured as other nerves. The reason is this nerve is just fine branched into the muscles. So if you have fracture, it's almost kind of avoid fracture. So we leave that alone. Next nerve, which one? Median nerve, right? Oh, radial. Okay. Radial nerve is a nerve supplies all the extensors. So triceps brachii, all the extensors, 5 of them also deep muscle, is all the posterior arm and forearm, everyone, radial nerve. Also, in addition, is the anterior muscle called the brachioradialis, and this muscle is always odd. Brachioradialis belongs to the anterior, so flex your forearm. But this muscle also does the pronation, supination, and innervated by posterior compartment nerve, radial nerve. So this is everything on the posterior, also along the brachioradialis by radial nerve. You may highlight radial nerve injury. If we have a radial nerve injury and we cannot do the extension, and we have a wrist drop or drop of the wrist, and also sometimes involved with elbow. So patient walks in, goes this way. If you see somebody walks in the office, radial nerve injury. So cannot do the extension, and also cannot do the extension. So there's just like this, all flexion. Okay, so that is the radial nerve injury. I do have question here, highlight. Are we good? Next is median, right? Okay. The median nerve is the same size as radial nerve, but just more anterior. And it goes to all the flexors of the anterior compartment of the forearm. So all here. This is the median nerve. This muscle take care by muscular cutaneous nerve. And this here, radial nerve. But here is the median nerve and the ulnar nerve. So median nerve supplies, you may want to highlight, median nerve supplies all the flexors I'm teaching you except one, except flexor carpi ulnaris. So that means median nerve supplies pronator tears, the first P, flexor carpi radialis, PF, another P, humerus longus, another F, flexor carpi ulnaris. But the flexor carpi ulnaris is supplied by ulnar nerve, okay, not the median nerve. So median nerve does not go there. The median nerve also supplies this muscle, flexor digitorum superficialis. Okay, then also supply this muscle. So I'm going to ask you, what is this muscle after superficialis or deeper to the superficialis? Okay. Not bend this.
I think you pull it out.
Yeah. Okay, so deeper down this muscle, the tendon, more ulnar side, because I don't ask you flexor pollicis longus, so more ulnar side, and you see the nerve, you see the vessels, is a flexor digitorum profundus, all innervated by median nerve. Okay, so the median nerve injury. Okay, let me finish ulnar nerve, so then we can talk about the injury. Ulnar nerve supplies 1.5 flexors on the forearm, flexor carpi ulnaris, and also part of the flexor digitorum profundus on ulnar side. So see, this yellow is ulnar nerve, and this yellow is the median nerve. So the ulnar nerve goes this side. But the ulnar nerve does is this, and you may want to highlight. Ulnar nerve supplies hands muscles. The hands muscle, there are more than 15 of them. So I didn't give it to you. You need to move to the either 500, just upper level, to know those muscles. So those muscles, the hands muscle, look at my hands muscle, is between the metacarpal bones, and their contraction is actually not the flexion extension. Their truncatus is doing the adduction, abduction, adduction, abduction. So if we have a median nerve injury, it's called a median nerve palsy. Okay, the details I will not ask you, I will show you. Median nerve injury, first out, we cannot do the pronation anymore because the pronator tears is here. Pronator quadratus I did not give you is here. So we lost the pronation. Okay, median nerve injury. Median nerve injury, we may lose part of the flexion of the wrist, maybe not complete, because we still have flexor carpi ulnaris by ulnar nerve. So far so good. But we lost the muscle is the flexor digitorum superficialis. So we lost the flexor of the proximal interphalangeal. And here, distal interphalangeal. So